Welcome to Not on the Beeb, another show for you with a very interesting guest today who's got a very interesting perspective coming from a doctor who's had first-hand experience of dealing with hospitals and the NHS. So I'd like to welcome you, give you the floor and hand over to you so you can start telling us all about yourself.
Thanks, Mark. So I've not had an unusual experience in some ways in that I've been a patient during 2020 and 2021. It's not the first time. I'm not one of those miraculous doctors that's never been sick. I've actually had quite a few operations during my lifetime. And I trained in the early 1990s as a medical doctor. And I also spent, alongside being a medic and becoming a GP eventually, after doing hospital jobs and medical and surgical jobs there, also taught medical students for 10 years as well. So I've had quite a lot of experience around being the doctor and the patient over the years. And in fact, actually, I fell in love with my husband when we were both in the very early days after I met him, and I heard him talking about how much he cared about his patients, and I just that just warmed my heart. So yeah, I went into medicine because I love people. They fascinate me, and I'm really into understanding what makes people tick in their minds and their bodies, and I just think life and them is absolutely amazing. So that's how I got into medicine.
Well, we're lucky to have you trained and doing all that great work for everyone in the country. Absolutely fantastic. So tell us a bit more about your personal experience then of what's happened.
Yeah. So in the autumn of 2020, I was actually away from home. It was at a point in the various lockdowns where you were allowed to travel, and I'd gone away with my family for a holiday. And I developed a really severe, I don't know if this is back to front on the screen, but I'm holding my left shoulder. I don't know if it's right for you, but a really severe left shoulder pain. Mm-hmm. And nothing could get away from this pain. And the first night of having this, despite being a medic and knowing that a left shoulder pain of that severity could be something from my heart or my lungs, I basically tried to stick out the night with it. I couldn't sleep at all. In the morning, nothing seemed to help the pain. I'm usually very fit and well, apart from the operations that I've had, like my background health, I'm not taking any medications or anything like that. Mm-hmm. So I kind of wasn't a high risk person for having a heart attack or something like that. And I was still breathing okay. So I got to the point which I think a lot of people have got to in 2020 and 21, where I went, in normal circumstances, I would seek medical help now. Mm-hmm. But I understand that the hospitals are overwhelmed, so let's just see if I can sit this out a bit longer. Mm-hmm. So I tried at home, where we were away for the rest of that day. And then that night, I was just in unbearable pain. And I'd got my child and my husband in the holiday flat with me. And I just thought, there's so much going on. I don't want to get a blue light ambulance in the middle of the night. If I dial 111 and I speak to NHS Direct, I know from the answers I'm going to give to certain questions that they're going to blue light me, because they'd be negligent if they didn't. So again, I thought, I can't really access healthcare. I'll wait till the morning and get my husband to drive me to the hospital. Strangely enough, the area we were in, I had actually done one of my very first medical jobs here. And so I knew the hospital, a very major hospital, and I just thought, okay, I know where to go. I know the correct hospital in this area to go to. We'll wait till the morning. Now at 3-4 in the morning, the pain was so bad and I was just didn't know what was going on, that I actually got up, and in the bathroom, just stood there, moving my arm like this, going, okay, I know this really bad pain is not coming from my shoulder. I can move my arm doesn't hurt here, but in here was just like the most excruciating pain going right through there, and any attempt at lying down was making the pain worse. So I knew I needed full investigation. So as soon as my husband woke up, I just said to both of them, I've got to go to hospital, you've got to drive me there. So when we got there, the hospital had actually, the entrances were all different than they used to be. It's quite a lot of years ago since I did my first medical job, but so I didn't know where the parking was or anything else. So he dropped me off and I went into the accident and emergency department. Now, by the time I'd had that half-hour journey from where we were to that hospital, I was even worse, because every bump of the journey, the pain was just getting more and more excruciating. And by this stage, I had actually realized that any attempt at breathing properly made the pain much, much worse. So although I wasn't breathless as such, I didn't feel like I had a problem breathing, so I wasn't panicking I'd got COVID or something like that. I knew something was wrong at my diaphragm level. So that meant it had to be something wrong, either in my abdomen or pelvis or in my heart or lungs, because when a deep breath hurts you in your shoulder, it suggests there's something wrong. There's even a rhyme we teach in medical school without getting too boring, but we say C345 keeps the diaphragm alive, because there's this phrenic nerve that runs down from the top of the spine area to do with how we grow as embryos, but it means that you can get shoulder pain that's not from your shoulder. And so by the time I was walking into A&E, I was clutching air, tears were just rolling down my face from the pain. And there were two people on the door, a security person and someone who I don't even know if they were security or a nurse or what they were. And they were there with their masks on and just ready to kind of go, what are you doing here? I'd put a mask on by then, a homemade mask, and put that over. And as I started to answer, these two lovely human beings just ushered me straight through and said, you'll get a scene straight away. Just stand there, and like took me to the place and a marked out spot where I had to stand. So they'd stopped asking all the questions, you know, they just started to say, what are you doing here? And just move me through. Right. So I thought, well, this is great, you know, and I stood there and it felt like an age, but I was the next person to be seen by reception. Now, at this point, I've got a mask on. So I'm like this. I've got tears streaming down my face and sniffling. When I cry, I make a good go of it. You know, I'm a real snotter, you know, one of those people. Yeah. So I'm trying to speak to her. She can't take my details. She can't hear me properly. She's behind her plastic barricade. And she said, take your mask off. I can't hear you. So I take my mask off to tell her. Still hard to hear me because I'm crying, but easier. Mm-hmm. And after what felt like an age, she clocked me in and said, the triage nurse will call you through. So I'm back standing there with my mask on. Now, at this point, I've already seen on the wall, all over the place, you must wear a mask, and this is how you must wear it to be in this department. So it already felt like there wasn't any option, like, if it is safe for you to wear a mask, wear a mask. I already felt like it didn't matter how I medically was. If I wanted to get into this accident emergency department, I needed to have a mask on. So that felt like a no option thing. Maybe we'll go into it in a bit, but because of what I already knew from my medical background and everything else, I felt medically actually it was inappropriate for me to have a mask on. It wasn't protecting me, it wasn't protecting others, and it was harming me because of the state I was in at that point. The next thing that happened is quite awful, but I just want to say that I don't hold it against her, because I understand that the situation had become so distorted that people don't know how it's distorting how they're behaving. So I've now got a 9 out of 10 pain. I've been recognised even by a security guard that there is something so desperately wrong with me, I need to be seen. And she takes me into the triage department. I start to get a lecture and say, what are you doing here with a shoulder pain? This is an emergency department. Did you call 111? And I said, no, like I've got a terrible pain and there's nothing wrong with my muscles. Like I haven't had an injury. And she just carried on telling me off with tears streaming down my face in pain with my mask on, didn't even offer me a tissue. And I had to say, can I have a tissue? And just carried on telling me off. And so she had on her notes that I'm a medic. So imagine if I wasn't a medic, that's how she spoke to a medic. That what are you doing here?
She was a nurse. Was she a nurse?
Yeah, so she was a senior triage nurse. This is incredibly. This is, you know, when I worked in A&E, that was one of the many jobs I did was in accident emergency department, and I still remember to this day a nurse called Debbie, and we were like the A team together. Like we could just look at each other and we would know. We would know if we were saying this is something really serious, like I'm just going to ask you for something, but she knows, get that right now. We're in trouble here with this patient. Something's really wrong, right? So I'm used to like real respect with triage nurses and linchpin of the team, you know, really important. Yeah. And I'm getting told off with a 9 out of 10 pain in my shoulder, and she's saying, dismissing me and saying I shouldn't be here.
And this is also in the hospital where you worked before.
Yeah. Like,
but these staff didn't recognise you from before.
Oh no. Like you don't have that kind of retention of staff. I am a bit older than I look. Right. So no, a lot of stuff would have moved on. But actually that isn't where I did accident and emergency. That was actually in another department. I'd done a different specialty in that one.
Okay.
I'd done general medicine and renal there, and actually HIV as well in hematology, but yeah, so different specialties there. So yeah, so some of those stuff might have been the same, but you don't spend quite as much time in A&E when you're doing the other stuff.
I'm just interested, but did you, when you first met that nurse, did you kind of say, I'm a doctor and I used to work in this hospital, like, you know, a few years back? Did she actually know that verbally?
She didn't know that at all, because I mean, recounting a 9 out of 10 pain and experiencing it are not the same thing. So I just needed immediate medical help. So I wasn't into kind of chit chat.
No, of course not. Yeah. You just.
And then I went into shock, you know, that I'm getting told off. And I literally was there with this going, but I got a really bad pain in my shoulder. Like I need an ECG. I was having to literally say, you need to do an ECG on me and rule out whether I'm having a heart attack or whether I've got a blood clot on my lung. I was having to actually say that. And she said, well, it's not like you've got any abdominal pain or anything or chest pain. And I said, I have got abdominal pain. You haven't asked me. When I breathe, it hurts my abdomen a bit and it hurts my shoulder a lot. And then she was like, okay. And then, you know, the nurse will call you through in a minute. So I had to go back outside. Then another nurse calls me into the department after another, I don't know, everything feels forever when you've got a pain that bad. But I get called into the department. And still there's this sense that they're not connecting with me as a human being in pain. I mean, I've been a patient in hospitals before. I've worked in lots and lots of hospitals. I know doctors, nurses, like everyone else, you get absolute amazing ones. Yes, there's always, you know, you get the rough one as well. You know, you're not going to have a whole team that's just impeccable human beings.
No.
But I don't believe you're that unlucky in a department that the next person doesn't treat you like a human either, or the next one. And so basically the nurse, actually, I remember this next nurse, and she did my basic obs, so my pulse and my blood pressure and my pulse oximetry to see what my oxygen saturation was. And when my pulse came up really, really high, so I had a tachycardia, she actually said, "Oh, you're really anxious." And I went, "No, I'm in pain. Like, my pulse is high because I'm in pain." And it just didn't get that. But look at the difference. I'm in pain. I'm in pain. If you're really connecting, you can see it in people's eyes. But this T-zone is so important for communication. And that's why I say I don't blame these people, because this is where we know everything of communication.
Right.
And there's a professor that's been studying this. He's actually a clinical psychologist called Paul Ekman. He's been studying this for decades. And the amazing thing about this T-zone of the face is it's universal. Right. In tribes that have never seen anyone else in the world, a smile still means a smile. A tear still means a tear. All these facial expressions are universal. And so when you're deprived of that, people can look strange, they can look frightening, they can look lots of things.
And what percentage do you think of that T-zone communication is taken away with a mask?
It's hard to say. I mean, I'd say it's like 80%, but I mean, I don't know. I'm being
like
speculative.
The majority.
But, you know, these parts around here, you know, they're really important. And people can get more and more skilled up to it. So, you know, with different cultural and religious beliefs where people may be used to exposing less of their face, within those communities, people can be very used to reading expressions from a smaller window of opportunity, if you like.
I just want to jump in with one point there, just to kind of bring my experience on this. When I came back to filmmaking, I'd been traveling around the world and been to kind of over 50 countries. And I thought, I want to make a film that could go to as many countries as I traveled to. So when I was thinking about it, I thought, what breaks down, what causes barriers between different countries? And it's language. So I made a film without language. I made a silent movie with completely no written words in, no captions, anything. It was actually much harder than it looks, because even the old silent movies always had a little caption kind of coming up for the complicated bit, like I just bumped into your wife around the corner, you know, because that is very hard to put across on someone's face. But the film did very, very well. It went to over 50 countries, and I was very lucky to be in a lot of film festivals with it. And whenever I stood up on stage, people asked me these questions about it, and I said, well, communication, 80% of communication is with body language. So the vast majority, and of course, with our bodies, we can use our hands to do things, and it does help. You know, you can kind of do all this, but the face is where the detail comes in. And you know, there was a time I flew to Italy without wearing a mask because I'm exempt. But when I went into the local supermarket, the guy, I just couldn't defend myself. I didn't know the word for exempt in Italian. I didn't know what to do. So actually, I'd been given a mask and been put in my back pocket by my hosts. And I was like, I'm never going to wear this, but I did. And I wore it around the supermarket. And I bumped into a lady going up the aisle. And I, of course, turned around and said, oh, you know, like, don't worry, and everything else. And she was like backing off. And I was like, no, don't worry. It's fine, you know, big smile to her. That was an accident. And then she was actually scooting away with her food trolley, keeping an eye on me, thinking I was going to attack her. And then I was like, oh my goodness me, she thought I was angry. And yet I was smiling at her, but she couldn't see what my emotion was. And it was like, right, that's it. So, you know, I'm never under any circumstance wearing a mask again.
Yeah.
Anyway, back to, that's just the importance of bodily communication in the face. So you're in A&E, you're in a 9 out of 10 pain. You're trying to express as a doctor to the lead nurses there your situation, and they're not understanding you.
Yeah. And then the doctor, A&E doctor, who is actually the grade just below consultant, so registrar, he came to see me and examine me. Again, still got the mask on. And again, just feeling like not understanding what I'm telling him. You know, it's all about, you look anxious. It's like, because I'm in pain. And despite explaining that I'd got the pain in the abdomen, but it was just nowhere near as bad as that, and to take a deep breath hurt because it came to the shoulder, it was already kind of making presumptions I'd got a shoulder problem. And again, you know, I've worked with doctors who are not as good as other doctors. You know, not everyone is as good as taking a history and doing examinations, but I have to say, normally a registrar grade of A&E doctor, they're usually the bee's knees, to be honest. They're usually very, very good. And certainly they're very good at their knowledge base, you know, it's normally amazing. I wouldn't expect to have to tell a registrar the checklist they need to go through with someone in severe pain that is made worse by taking proper breaths. You know, this is basic stuff. And I would have thought there's people who are listening in who have got no medical background or nursing background whatsoever, and they're still thinking, oh, shoulder pain, don't you know, I think I might have heard about that for heart attacks and things like that, you know, but the list actually goes on. You know, it's a really pretty thorough list of things that you've got to think about, including things like an ectopic pregnancy, which can kill you if people miss it. You know, someone can present just with a left shoulder pain.
Is that right? The left shoulder could indicate.
Yeah, it can do. Wow. You know, wow. And in fact, I think I remember in one of my when I was doing obstetrics and gynecology, I did actually have a few patients with ectopic pregnancy. I seem to remember one of them who luckily didn't die, but was very, very ill, and she had presented with the left shoulder pain and not with the abdominal pain being the worst thing. So it's a really serious thing. So he then ordered that I would get an ECG, the heart trace, and a chest X-ray. And I was having to still ask, you know, for some pain relief. So I still had no pain relief. And then the nurse said she'd go and get me some codeine. And I was just like, I think I need something better than codeine, but just like, fine. You know, it actually takes a bit of time to absorb that. You don't normally do that for someone in that degree. Now, behind the scenes, a consultant that I never saw apparently then said I should have some Oromorph, so some oral morphine that gets quickly absorbed, and came back with that and said, thank goodness. And then I just was there on the trolley, no one with me, mask there. I literally felt I could have died and nobody would have noticed. And so I've got access in my past that I've learned a lot of really good meditation techniques. So I'm there with my Oromorph on board and I'm meditating, just literally trying to concentrate on any part of my body that was not in pain and take all my energy there. And I was there for hours and hours. And I felt when I spoke to other nurses and asked them and said, you know, what's happening? And they were just, you know, it was as if I wasn't human. I mean, it was really weird. And I missed a really crucial bit. When I arrived at A&E on a Saturday morning, there was one other man sitting in one of the kind of plastic solid chair things who looked like maybe he was waiting for someone. There was no one else in the whole department on a Saturday morning.
A&E. No.
In a major A&E. This is a major A&E with a huge population it covers. Mm. So when I was inside A&E and I was waiting, I could see an old man who was across the way from me, an elderly man had fallen and banged his head. And he was actually hallucinating with his mask on and thinking that people around him were maybe ghosts. And then I could hear somebody else who'd come in next to me, but I couldn't see them because they were in the next bit along. So this wasn't a chaotic A&E. This is somebody, I've worked in accident emergency departments. You can tell when things are under great strain. Mm. And this was not a department under great strain. And yet I was having this really inadequate care, really inadequate care. When I just thought, do you know what? I'm safer back at home now. I'm safer back with my family. At least they'll die 999 if I die. That's what it felt like. And I just said, I actually want to go home now. And they said, no, we just need your bed. You go up to the GP unit in this hospital now. We're taking you up there. And I was just like, I actually want to go. I tried to communicate and said that I hadn't got my husband's phone number and all kind of complicated stuff. So communication. So I'd actually had no communication with the outside world from the minute I went in either. So he was just there sitting in a car park in the hospital, and we had no way of being in touch. I had no phone on me. And I went up to on my way up to the GP department, then in the wheelchair, then a lovely man, a nurse said to me, he said, you're not, and I nearly said my name then, but he said, you're not her, are you? And I said, yeah. He said, we've been looking everywhere for you because you've got a CT scan booked to in the department. We've been looking for you. I mean, this is the department, like there's like 4 beds there, and they've been looking for me. So basically, this doctor, what had happened is my result had come back from my chest x-ray and my blood, and it didn't exclude that I hadn't had a clot on the lung. So they'd ordered the next test up, a fancy thing. But I had to go up to the GP department for a doctor to finally talk to me properly and do that, and together decide, yes, I should go ahead and have this CT scan. But we both agreed at that point it was unlikely I'd got a clot on my lung, because that didn't represent what was going wrong with me. But the first thing he did when he saw me was say, when did you last have any pain relief? And so before he tried to communicate with me anymore, he gave me pain relief. So I had become a human. But he was concentrating at my eyes. He was trying to connect with me. What then happened was that when that scan came back, it turned out I was actually bleeding from a liver cyst. So that was what was causing the irritation, is I had got a bleeding liver cyst. Now, I had then had 2 doses of Oromorph, and I was feeling like a lot more comfortable. So we then had a debate about what to do next, and I basically said that I would rather go home and come back in if I needed to, and they would order me to have a follow-up scan the next morning, a different kind of scan, to have a look at this. Overnight I was much better than I had been, so presumably this liver cyst had actually stopped bleeding by then, or had slowed down. Then came back in again, had to be masked up and everything, had that result. I'm going to end that part of the story there, because this is where there's another part to the tale and another part that becomes significant. But basically, I was then stable and okay. And so it was left back that when I was in my hometown, that I would contact my GP and get follow-up to what was wrong with me. So I'd stabilised completely. And the GP unit had called me again a few days later just to check that I was okay. And I said, yeah, I mean, I'm nothing like what I was. And we talked about follow-up. So then what had happened is I was back in my hometown, feeling much better, thinking I must get in touch with my GP. But again, thinking, don't want to overwhelm the GP, and I'm feeling much better, I'll just wait. And then I got suddenly very, very, very sick again. So excruciating pain again. And this time I'm like, okay, I can't just turn up at the accident and emergency department. I know how bad that went, so I better do the 111 this time. So this time I did the 111. Now, bear in mind, I'm a medic. I know how to answer the questions. You know, I was a long time on the phone, and they wouldn't let another family member do it for me before they went, yes, you need to go to A&E. Okay, so in excruciating pain, you go through this 10, 15, 20-minute phone call. And that was with me even saying, it's okay, I know what the diagnosis is because I've already had a scan, you know, a week to 10 days ago. but you go through this all in pain, terrible pain, get to the hospital, turn up, totally gruff. What are you doing here? Are you booked in through 111? Like, that's how
this is a different hospital. This is now your local hospital where you live.
My local hospital. Again, it's a major hospital. This isn't a cottage hospital or something. You know, it's a major hospital. But that's how I'm spoken to. So I'm turning up in terrible pain again, and it's an accusatory. What are you doing here? That's the way. It's not, hi, got to book you in, find out what it is. So I said, yes, 111. It said, this is my name. They're supposed to have had me booked in. And then they said, oh, you're not there. And then I think she found that I was there. And it was like, sit there. Husband not allowed to be with me anymore. So then you sit on your own in A&E department again. I've been in that A&E department with my mother and with other family members. And it's normally heaving. And again, there's like 3-4 people in the whole department, and yet it still takes an age to get seen. And the whole time masked up like this again. And when I got in there,
just 1 second, just to jump in. So you've been in that same A&E department briefly before with your family members?
Multiple times.
And how would you rated this as an A&E department with your experience?
I'm a very fussy person in terms of how people need to be treated as patients. So I probably have quite a scale where if somebody is very knowledgeable but not compassionate, I don't rank them highly, or I expect compassion. And I'd been there quite a few times with different family members, and I'd say the experience were variable, maybe like, I don't know, like a 7 to 8 out of 10, maybe.
Okay.
Yeah.
7 to 8 out of 10. And what would you be giving it on this experience now when you just come back in now?
So there's various different staff at different points, but at the starting point, you're at a 2 out of 10.
Right. So, okay.
Yeah.
So it's matching. So basically, what you've observed is just 2 hospitals, which have something crazy's happened.
Something crazy's happened, and if instead of kind of demonizing people and saying, what wretched people, if instead of that, particularly when this happens in the second hospital, and you think, but I've been to this hospital before, you have to think, what has happened that has made people that have gone into caring profession start to behave this way? I felt that I was going onto a military site, not in terms of it was loads and loads of military around, but that kind of, it felt like it was a checkpoint. Yeah. It didn't feel like a place of care. Okay. And just no compassion left at all. When I got in there, I was very, very nauseous with the problem that was happening. And I got given a anti-sickness, it's called an antiemetic drug, into my vein. I've had a severe reaction to an antiemetic before. So they were aware of that and gave me a different one, not the one I'm allergic to. I had a severe reaction to this drug. So it's a drug reaction that's known about, but rare. And it's something that there actually is an antidote for. One of the big ways you can tell what's going on is from here. So I'm feeling sick. I'm very sick. I'm here with a sick bowl and I've still got a mask on. How is that right? So then what happens, this particular reaction to this drug, you get these funny spasms, things like that.
Wow. Wow.
And it's part of the spasm that this drug causes. Now, luckily, because of my training, I'd actually seen somebody with this reaction before. So I knew that there was an antidote to it. So it happened to be within my realm of experience. So I'm like there and going, it's cover this, I'm having a reaction to the drug and, struggling, but all with a mask on still. Yeah. And then they're trying to gave me the first injection of the antidote, and I had managed to verbalize, what it was that I was having, because a lot of even quite experienced nurses and junior doctors might have never come across this,
So you actually told them, told them what was happening. They got that information of what the antidote was needed from you.
Of the diagnosis. I think from what I remember, having said what was going on, the doctor that was treating me then actually spoke to another senior doctor who then was prescribed the antidote medication for it. But one of the things they needed to do was to monitor the result of that, how that was going. And I expect it doesn't take much imagination to imagine how frightening it is when you're having spasms of your oral facial muscles. It's really scary. So I was with the nurse that was with me, said, I need to just hold your hand and look at your eyes and please just count my breath with me. I'm really scared. And so I had my bare hand and her gloved hand. And I was doing that. And it was only when they were really worried about me that my mask came off for the first time. I can't remember if it was when I was trying to vomit or something, but that was the first time my mask had come off in this whole scenario. And then me having to work really hard to connect with this nurse, just looking at her eyes, because again, her face is all covered up, to kind of talk me through while the antidote had a chance to work. What that told me from her behaviour is that these are normal, kind health professionals in normal circumstances, that people have just started following a set of rules, because actually medicine and nursing over the last couple of decades has become quite protocol driven, which has fors and againsts. But these are normal human beings, but they've started following the COVID protocol. They've started following the protocols that have been told to do, which actually are political protocols and are not to do with health and healing. When I then got up to the ward, I'm sorry, this story's got quite long, but I got up to the ward eventually to get admitted, and they said, well, do your PCR test now. Now, as a medic, I had really read about PCR tests. So I knew that they were causing a fear and a misinformation amongst the general public. And I didn't want to be a part of that. So even though I was really, really ill, I said, I don't want a PCR test. I don't agree with it. And I then ended up in a situation where I'm about to get admitted, where I had a consultant, a registrar, so 2 doctors, and a senior nurse in a room with me, where they were supposed to be waiting for my husband to bring my things so that I could be admitted. So my husband came in, so he witnessed what they said to me as well. And they then went from admitting me to saying, we're happy to let you go now, because I wouldn't have a PCR test. Now, when I queried this and I said, but have you looked at the evidence? Like, there is no you know, do you know about the false positives, you know, and how it's actually documented on this test that it's not for diagnostic purposes? Like, you know, I'm talking their language with them. There was no engagement. The doctor just said, but you're the first one who's ever queried this. And I said, but I am querying it. And he said, but we have to do it.
Wow.
It's all we've got. So as in they had to do it on themselves, yeah?
Mm-hmm. Yeah. That just reminds me of at the airports with going through the detectors, because we know about the safety of those detectors. But that's always the argument the staff at the airports give for the detectors is, well, we do it every day. And we're still, so it must be safe. And it's like, well, you haven't read what, you know, people are refusing to go in those machines for a reason, including the boss of the guy who actually manufactured the machines. He won't step inside them. So we've read that, we know it. So that's the naivety, you know, this is how staff get kind of pulled along. And if it's good enough for us, it must be good enough for you. But you've done your research.
But there's an element that's more disturbing about this for me, and that is that medics don't always see eye to eye. We're used to having discussions about things, you know. You might have, you know, a group of medics that treat a certain illness some way and another group treat it another way. Used to having a discussion. I was open to hearing what they had to say. Do you know? If they'd said, well, actually, you know, the reason is this and because of that. But no, the reason is because I tell you to, you know.
Because follow the rules. Yeah.
And that's what really horrified me, that something had gone really terribly wrong at that point. Just to give you a little bit of background, when I did my membership at the Royal College of GPs, which is going back a couple of decades now, you actually fail. So as in you can't become a member of the Royal College of GPs if when you're doing your video consultations with real patients and with permission and so on, if you do not find out what their fears and expectations are, if you do not offer them choices, so even if you think something is completely black and white, like this is the only treatment option for you, if you present it in that way and don't go, well, there's the option of no treatment or this treatment, if you do not give them the options, if you do not seek to understand their point of view, you fail. Okay, so you cannot become a member of the Royal College of GPs if you do not do that. So how, 2 decades further on, can you just say the reason you're going to have this test is because that's what we have to do? Like, there was literally no medical explanation for me or for the greater good. Now, actually, as a medic, you must always be thinking of the greater good of the person in front of you at that moment. That is what you must do, to do with all kinds of ethical laws in medicine. But it wasn't even like this might be harmful for you, but actually this is great for everyone else. There was no medical explanation or justification in any way. And without getting too boring about PCR tests, but there's the amount of cycles that PCR tests go through, no idea on that. They had no idea.
But this is the most basic thing. You can't look at the PCR test if you don't understand the cycle thresholds. You can't justify it, because the cycle thresholds are how it works, and everyone knows, because it's been written by even the, you know, from Fauci and everything else. Anything over 33 to 34 cycle thresholds means it's completely invalid. It's like doing 34 photocopies of an image.
It's probably lower than that, about where the cutoff should be, and it still shouldn't be used for diagnostic purposes. So still, someone with no symptoms of a respiratory illness at all should not be having one.
No. Yeah.
So I went home. So because my principles are such, and I know this is going to be quite hard for some people to understand who don't know me, but like ethics is just really, really high in my life. So even though I needed to be admitted to hospital, I couldn't make that decision and think that I would be part of creating something for the greater harm. Like, I just couldn't do that. So I went home in a lot of pain. I'd still got some oral morph left from when I'd been discharged from the other hospital, because I hadn't ended up needing it all because my pain got better. So I just started medicating at home.
You just said you went home there. Let me just step in, because you made it sound like it's your choice. Now, when I'm listening to your story, you were basically blackmailed, you were threatened. It was, you take this PCR test, otherwise we withdraw the medical treatment that you need. So we all agree you need to be admitted. The doctors are all saying, you need to be in this hospital, you need this treatment. But if you don't take this PCR test, then we're withdrawing that care from you. And we give you, the option they gave you was to refuse it, but then you're not given the medical care you need. And that's, and it's not just unethical from a medical point of view. You've worked in hospitals, you're part of the NHS, it's unbelievable. It's absolutely, whichever level you look at.
I just want to say at that point that the only thing that makes it more interesting, this story about me being a medic, is just that I have their language. They should be treating everybody on a level, and that's another thing that's gone very, very wrong. It should be very wrong.
We know that's not what happens there.
Yeah, very wrong. But yeah, I mean, I still remember, we're happy to let you go. So it literally changed from my husband bringing in my stuff for me to be admitted to, we're happy to let you go.
We're happy to let you go is, I mean, talk about disguising language.
Yeah.
We're happy to let you go. Yeah, amazing.
Yeah, and what kind of let you go was that?
And what are they, what could have happened to you with the situation you're in if you've got a cyst that's bleeding in your liver? This is life-threatening.
Yes, so at this point, this isn't even like the time before. At this point, they've already know that I've had a scan within the last 2 weeks that showed I had a bleeding liver cyst. So although they've only done, I think, some blood tests at that point, they hadn't done any scans or x-rays or anything. They already had the information that this is somebody who we know has a bleeding liver cyst and now is in excruciating pain. There's nothing in my medical training. I mean, I nearly became a surgeon. I was very passionate about surgery as well. Worked for an incredible surgeon. Interestingly, he didn't wear a mask. And so I've been exposed to the knowledge about masks from a really long time ago.
So he didn't wear a mask in the theatre?
He didn't, because he wore glasses, and actually he taught me and other people that worked with him that actually it's just to save you from splashes of, big splashes of blood and whatever. It's no protection for the patient. And in fact, they've done trials to show that not just the surgeons, but the patients have no higher instance of infections or anything else. I'm not suggesting we're all going to stop wearing masks within surgery, because I think it's, the splash thing does matter and stuff, but it's just important to realize, as soon as you've worn a mask for 20, 30 minutes and it's moist, everything can come through in both directions. Sorry, I got completely off the point there. Just remembering.
I think that's very on the. I think that's very on the point. I think that's really like a major part of it, and it shows your experience with it. Because this is what's so amazing about having you as a guest here. Because when anybody else says the same thing, if they've done their research and they don't want to wear a mask, they will get labelled as crazy or mad. If they don't refuse the PCR test, they'll get labelled as crazy or mad. But you, with your experience and your background, I mean, right up to the level of working underneath a top surgeon who didn't wear a mask because he'd done his research at that point before this masks got politicised, is absolutely vital information, and will be, and I'm sure everybody watching would just absolutely love to hear that. Yeah, we'd be loving to hear that from you.
I can't overemphasize the purpose of the mask has been ritualized, completely ritualized, and although there is the ritual within surgery that you wear masks, I would say that's not that harmful a ritual by comparison. It's an idea of cleanliness, and you know, it's not that damaging a ritual, but it would have been for that surgeon, because it would steamed up his glasses, and also he didn't breathe as well with it on, and so actually he would have had worse outcomes, and he was the best surgeon in the hospital. He was absolutely brilliant.
And just to point out, patients, if you ask the patient, would you like your surgeon who's cutting you open to be able to see perfectly well, and also have enough oxygen going to his brain so he's not getting dizzy? I think most patients go, yeah, absolutely fine.
But I realise we're going a bit off point to kind of the discussion about whether or not surgeons could wear masks, but it's just worth understanding that there's not been some magical thing out there. You know, medics really have known the thing about once you've worn a mask for more than half an hour, it doesn't really do anything. Medics have known that for a really long time. You know, and so what now happens, that suddenly you can't have a medical discussion anymore. Suddenly you're happy to let a patient go who you would have admitted because they haven't done a test. There was no option. Where was the option two of like, well, if you're not prepared to have the test, I'm going to have to just presume you've got COVID and I'm going to admit you to a COVID ward? I don't know. There was no actual other choice. It was like, you have the test and you're the only one who's queried this. They didn't know what to do with me. You know, the compassionate part of me felt sorry for them because they literally didn't know what to do with me. Nobody has questioned this before at that stage. I'm sure more people have now.
But they're not feeling, but you're feeling compassion for them, but they're not feeling compassion for you. Because let's just take this, I've just thought of another parallel within ships. Can you imagine being on a boat and there's people floating in the ocean? You know, a ship's gone down, there's people floating in the ocean, and you know you need to pour them on board and you're ready to flow some in the life jacket. But if you said this boat is of a certain religion and everyone has to hop and skip 3 jumps when you get on it, and someone says, well, I can't hop and skip because I've got a damaged leg or something, you say, well, I'm happy to let you go. That is illegal within, you know, the duty of any ship that comes. If you hear a ship that's sinking, you go along and pick them up. It's your duty to pick up anybody in the ocean. Hospitals are there to help people. Doctors, that's why everyone's entered healthcare, is to help people. So to be happy to let you go because you wouldn't dance through the hoop of a PCR test when we know how it's got no accuracy behind it. We know it's not even called the PCR test until this year. It's called the PCR, wasn't it? By Carrie Mullis. It's not diagnostic, like I said.
I guess what I'm trying to say is I'm really understand. One of my interests is the way that we think, that what makes us tick. And what I'm trying to say is that these are ordinary people behaving in an inhumane way who would have not been behaving that way before. So what I'm saying is we really need to understand what has happened to this process. What level of stuff have people been exposed to? That you've got doctors that are no longer questioning, that are no longer asking questions and are following just, I've been told to do that. I mean, I know I'm probably a little bit weird this way, but when I first became a medic, one of the things that was really always in my mind is I must never just follow orders. I've always, probably from the books that I've read, but I've always been aware how involved doctors were in Nazi Germany and beyond. And I've just thought I must never just follow orders. I must always have an ethical, moral compass within my own heart. I must always follow that.
This is such an important point. If I just, before you go on further there, if I can jump in, it's such an important point. And when I went to Berlin for the formation of for the massive protest then, formation of the World Doctors Alliance, and Dr. Schörning, when he spoke, mentioned as a German doctor, he said it's now been made illegal it's been illegal for a long time within the German constitution for people to say their excuse to be, I was following orders. So that is actually illegal to say. So everybody now has the responsibility to be ethical in whatever job they're in, whether it's the police, whether it's medical, or whether it's in the military, they have to be individually responsible for the actions they take because of what was experienced in World War II. So you're just
that's what came out of the Nuremberg trials. You know, the Nuremberg trials was following orders is not good enough.
Yeah,
it's not a good enough excuse.
Yeah. When I first read there was doctors involved in the camps, I remember as a young boy, I just couldn't get my head around it. Hang on, no, they had camp guards and they had people. They didn't have any doctors, and I was like, well, who made that guy a doctor who wanted to kill people? I was just even scratching my head thinking he must have been made a doctor after, because I couldn't just comprehend it.
Yeah, and I think you know, it's very easy to think that these must be specially bad doctors or bad nurses or whatever, but we've missed the point if we think that. What we have to understand is normal people are behaving in an unethical manner, that people are no longer following the processes that they should be following in terms of their independent thinking, because, in my opinion, they have been exposed to the same propaganda as the rest of us. And so if you've come off a long shift, and let's be honest, during autumn and winter season in hospitals, always without, you know, it is a heavy time of year in hospitals. And let's remember these, in the UK, we were working on 75% capacity. So because of COVID spacing, we'd actually got less hospital beds in the autumn, not more. Okay. So you expect there to be a busyness at that time of year. So are you going to come out of your shift and turn on the telly or the radio and hear a bit of that? Or are you going to think, I think I'll go online now and read the original journals and not the spin? Yeah. And I'm afraid to say, I think the former happened rather than the latter. And later, in another hospital where I finally had my surgery to resect my liver cyst, which by then on the scan was nearly halfway across my abdomen, it had grown to by then, whilst waiting for the urgent surgery that should have been within a couple of weeks, and it took more than a couple of months for me to get that surgery. But when I then had that done by a specialist team, I had a discussion with one of the surgical team afterwards, and somehow it came up to do with me not being vaccinated and not being interested in doing that. And again, I started to have a discussion, and actually she was really lovely, and she said, God, I'm really sorry, I'm like having a row with you the day after you've had major surgery. And I said, I am absolutely pleased for you to have a discussion with me. I'm sorry if it feels like a row to you. To me, it feels like a discussion. And she said, no, that I don't feel like you're rowing with me. And I said, this is what has been lacking. You know, where has the medical discussion been? I'm really happy to hear what you're telling me, and you can hear what I'm telling you. And actually, again, I found that she had experience from being on the wards. But again, when I cited different journal articles, you know, medical information, talking medic to medic, she had no idea of it. And I think, you know, the problem is when people are so busy and are in overwhelmed, not because the hospitals are overwhelmed, because we're overwhelmed, because society is overwhelmed, then you do not have the capacity to do that. And in fact, there's a different part of the brain that is working when you have been triggered into chronic fear. And so the brains of various animals, from kind of basic fish up to getting to primates and humans, have different kind of responses in their brains. And the most basic fear response is done by a part of the brain which in lay terms we call the reptilian brain. This part of the brain is very, very fast. It's much faster than this kind of slower thinking brain. So it will always hijack this. This is too slow compared with there's a snake there. That's what it's trained for. It's trained for you to act immediately. It goes with pattern recognition and lots of things. And so if you have people in chronic fear, they can't actually access their cognitive thinking in the same way, because they're constantly getting driven to this much faster part of the brain. And the brain is amazing. I mean, that part of the brain is really crucial, but we shouldn't abuse it. We shouldn't be misusing it that way, because it's the kind of part of the brain that when you see someone, going back to your analogy of someone drowning in the water, it's the part of your brain that just immediately goes out, becomes the most powerful, the most strong you've ever been, and you get them out the water. So it's a fantastic part of the brain. But you don't want to be in that part of the brain the whole time, because then you're going to be fight or flight or fright or finally freeze. And how many of us are actually now in a freeze response? And a freeze response only gets triggers if you feel that your life, or it can happen if you think the life of someone else, is in immediate danger.
Mm-hmm.
How often is we being triggered through the language into thinking that our life or the life of those that we care about is in immediate danger? And that's like a red flag to this part of the brain. Okay, let's keep it coming. Where's the fight? Where's the fight? Who's in the wrong? Yeah, it's that part of the brain. And then when you really think it's no good, you freeze. And what do you do when you're in a chronic freeze response? You stop reading, you stop doing the literature, because you are just,
It's true.
you're on autopilot. Okay, so this is where I mean that I can be really compassionate with these people, because they're being exposed to the same stuff as everybody else, and they're in autopilot. But they have actually taken their commitment with those careers, and they need to actively seek to come out of that autopilot. And now is the time for them to do that.
Yeah, absolutely brilliant. But they're being held in that position of autopilot by fear. It's fear that's holding them in that, right?
Yeah.
So for them to come out of it, what's the greatest fear-busting things you think they can do?
Okay, well, I can tell you what definitely works with acute trauma, because that's an area that I'm interested in. So like post-traumatic stress disorder, but when that acutely happens, it's actually the T-zone of the face. So it's from when we're a tiny young baby, right from the beginning. You can just look at somebody's face at that zone, and that can be enough to get somebody out of there. The other thing is human touch. So human touch. And the other thing is a very soothing, calming, not patronizing calming, but genuinely loving, calming voice. Those three things can really help people to come out of it. So you can see how we've been a little bit set up for failure, but it doesn't mean we are going to fail.
I'm just thinking about what you just said there, and I've just remembered that's kind of the paramedic thing, isn't it? When someone's in an accident, they're in extreme pain, maybe they're trapped in the car. It's that paramedic who just turns up, puts their face in front, looks them in the eye, and says, "Hey, you're right, you're right."
Yeah.
It is a bit of a shock, I broke my arm in half, and it was the paramedic joking with me. And I said, "Oh, you should have heard it when the bone snaps." He went, because you're lucky both did stand. I normally have it. You'd look at your hand. It made me laugh.
Yeah.
His face was close to me. Yeah.
I got appendicitis when I was hiking on the coast path years ago, and exactly that. The paramedic was just amazing in the back of the ambulance. It's just, they just keep it going, and it's so healing. It's incredible what that's capable of. Don't for 1 minute underestimate what your face is worth.
And what a smile is worth, right?
Yeah.
Oh, fantastic. I think, look, we've just done over an hour, and on that note of the power of a smile and power of human contact, I'd just like to leave it there for now. But I know that you've got some incredible stories, some incredible knowledge, so it'd just be amazing to have you back on and to continue the conversation another time. That'd be wonderful.
Thank you so much, Mark.
Thank you so much for your time, and thank you for sharing your story. And I just thank you on behalf of everybody watching, because I'm sure that's fascinating information. Thank you very much.
Thank you. Bye.
Okay. Cheers. Bye-bye.